Hello, everybody. Let me give a quick welcome and say we're going to wait a couple more minutes, make sure that everybody has a chance to sign in and get situated, and we'll be starting in just a minute. Thank you. All right, I think it probably makes sense for us to get started right now. So let me welcome everyone to the Institute for Mental Health Research 2021 webinar series, Navigating the Pandemic, Lessons Learned from Mental Health Research. My name is Keith Crnic, and I am the IMHR Chief Science Officer, and also in recent history, a faculty member at ASU and chair of the Department of Psychology there for 15 years. And now spending my time working with IMHR and developing research programs there, or research funding there. So today's webinar is on helping kids cope, how families manage pandemic-related stress. And in this webinar, we intend to explore a number of issues about the way children do cope, the way that stresses affect kids and families and parents specifically, right? Because families are an integrated unit for the most part. And we are going to be looking at ways that each of them are affected by stress and try to cope with that stress to learn some ways that might be effective in helping everybody. This, if you haven't been involved with either IMHR before or been part of our webinar series before, I'd like to take just a minute and tell you a little bit about the IMHR. The IMHR is an Arizona-based nonprofit organization whose primary mission is to offer seed research to promising and established Arizona-based investigators who are doing innovative research in mental health. We're really looking to help investigators start interesting new research programs with seed funding so that they can get data behind them to then pursue these questions more fully through larger research grants from national sources like the National Institutes of Health or other national foundations. Over the years, since it began in 2001, the Institute has funded more than $2 million in Arizona-based research grants. And investigators from Arizona who received this money have returned it tenfold back to Arizona in having garnered over $20 million in federal and national research support. What this money has done has expanded what we know about mental health research. It has also increased the career trajectories of the scientists who received that funding. And it also helps support the Arizona economy into bringing this money back and supporting research processes, hired people to help them do this work and brought money back just basically into the Arizona economy. So IMHR has been, I think, instrumentally successful in really making a difference in mental health research in Arizona, and even more nationally by the findings that our researchers have identified. The kind of work that we've supported in the past and the great things that have come out of here have to do with issues like identifying the pathways in the genome that are linked to mental illness, that have originated novel treatments for Alzheimer's disorder. We have increased understandings for depression and early intervening with depressive conditions. We pioneered also a treatment for first episode psychosis in young teens, or in actually, older teens and young adults. And this work in particular showed the translational significance of science in that from this work that identified evidence-based support for a specific treatment model, we were able to help establish the nation's first community-based clinic for intervening in first episode psychosis and have that be in the Phoenix area. So it's exciting work, and that's just scratching the surface of the work that IMHR has been able to fund over the years and to really make a difference with. So we're looking forward to doing more of that. Now, the second mission that the IMHR has is also one where we try to bring back to the community the knowledge that's been created by mental health research. And that's what we're doing here today with this webinar. But before we begin, let me just say that navigating this webinar is hopefully going to be an easy process. You probably already saw that there was an audience poll at the very beginning, and we really appreciate your efforts to really complete that, and thank you for that. There'll be another one coming up near the end of the webinar, and we really hope you'll complete that as well, because we use this information to streamline our webinars and to make them better over time. In the webinar viewing screen that each of you has, I'd like to just point out that you can use the chat function in the webinar screen, right, to ask any technical questions that come up. But also you can use the Q&A link to interact with either me or today's speaker, Dr. Carlson, during the Q&A session that's going to come up. So with that, hopefully we've done enough business to bring us up to date here. And we're gonna get started by having me introduce today's speaker, right? Dr. Ginger Carlson. Dr. Carlson is a clinical and pediatric psychologist in the Division of Psychology at Barrow Neurological Institute and Phoenix Children's Hospital. She trained in psychology at DePaul University in Chicago, a very highly regarded training university for clinical psychology, and then did her internship at the Children's Hospital of Los Angeles before coming to Arizona. She's a member of both the American and Arizona Psychological Associations and is licensed and board certified in clinical child and adolescent psychology. She's a highly regarded clinician with expertise in stress and coping, which is particularly relevant for today, in adolescence, and also in ethnic and minority influences in mental health. Beyond her impressive professional credentials, Dr. Carlson is also someone that I'm sure you're going to find to be very engaging, relatable, and has a keen sense of humor and a truly human perspective on the challenges of adaptation. So we're honored to have her as our primary speaker today, and please join me now in welcoming Dr. Ginger Carlson.
Good morning. Thank you so much for the introduction. Thank you to Dr. Crnic and the Institute for Mental Health Research. It's a pleasure to join you all today for this conversation. Let me begin this slideshow and we'll get started. Okay. I'd like to begin by acknowledging how stressful the past pandemic year has been. This global pandemic, which none of us have before dealt with in our lifetimes, is something I would have expected to see in a science fiction movie, but it came into our real world and it affects our whole world, every human being on the planet. That's a pretty significant, stressful event. COVID-19 started as a crisis, a single event, and many of us did not realize that it was to become a chronic stressor, something that was ongoing, that we would still be dealing with now a year later and may continue to deal with for a while to come. It cascaded into additional stressors that have really taken a toll on children and families. Dr. Crnic, would you like to tell us a little bit more about the impact of chronic stress?
Well, chronic stress, I mean, it just really means stress that we're repeatedly exposed to over time, right? It's something that you can't escape. And the pandemic is a perfect example of that, right? It's just that just is oppressive in terms of the nature of its effect over time, right? And the reason why we know that chronic stress is particularly problematic from a mental health point of view is because it really helps support the maintenance of mental health problems because of the capacity for stress to affect the stressful occurrences to affect the stress hormones, right, in the way they access the brain. Stress hormones, particularly things like cortisol, for example, right, we know has an impact on the way that people think, the way they behave, and the way that they process emotions. All of those things are affected, right? The research has shown us. Over the years, lots of studies have shown us that stress hormones lead to problems with people being able to attend to the appropriate information in their environments, what you can remember and how you remember it, and the way that we process emotions in ourselves and in other human beings. So each of these, right, if there are processing deficits in some way, right, each of these neuro impairments winds up being associated with psychopathology or behavior problems or emotion problems, however you want to think about that, right? And the continued exposure to these things is what's problematic. We all have acute kind of stressors in our lives in many ways. The acute stressors come and go and we kind of manage those. And as long as they don't keep coming back and back and back and back, we deal with them all right, right? It's the problem when these stressors become chronic, we can't escape them, that they build over time, and that they have larger effects.
Thank you. COVID created a whole new set of stressful situations that have become chronic stressors in and of themselves. We call these secondary stressors. There have been school closures across the nation and the globe. Children have moved to online schooling when they have access to the resources to do that. Child care facilities closed and parents had to look for other ways to care for their children at home. People have been laid off from jobs, had pay and benefit cuts. Some people have lost housing or had difficulty finding rentals. Some people have become homeless. There's been the closures of religious institutions. It's gone online and people haven't been able to come together with that support community. People have lost loved ones and been unable to go ahead with plans for funerals. So have sometimes taken transition to online memorial services or postpone them. We've had graduation ceremonies canceled, weddings postponed. People have been unable to visit family and been unable to travel. A lot of the things we do to distract ourselves and obtain enjoyment have not been possible because of the closures of a variety of venues like restaurants, sports arenas, theaters. School sports have been canceled. And all of this has had an impact on children and families. I think I can best illustrate that impact on children by sharing with you some of the things that my child patients have said to me and some of the things that my own children have said. It gives you an idea of what they've experienced over the past year. In the fall, my husband and I had to decide whether to allow our children to go back to school in person or whether to try to have them at home doing online education, largely unsupervised. When I asked my then 9-year-old what he wanted, he said, "I miss my friends, but I don't want to die." Several graduating high school seniors last spring and this year too, after their graduations were canceled, including one who was to be the valedictorian for their class, told me, "I've been working towards this for years, imagining what it would be like to walk across that stage with my family watching. Now it's been taken away. Everything is being taken away." A teenage boy said to me recently, I'm tired of the world ending. Just last week, a little 4-year-old girl explained to me, we go to the playground at night when no one is there because of the virus. And another young patient of mine at one appointment said, my grandma's in the hospital and I'm really worried. I've made this card for her. And on our Zoom telehealth visit, she held up the card, printer paper with crayon drawings, something any grandmother would love to receive. At our next appointment, a couple of weeks later, she said, my grandma died and she never got my card. As you can see, children experience these stressors as intensely and deeply as adults, perhaps even more so. They're impacted by the pandemic and they're aware of what's happening. They may share this in words, like some of those patients did with me. They may share it in behavior. So you may want to know how to know if your child is too stressed and if they need extra help. So here are some things to look for. We're looking for persistent changes in behavior. Temporary upsets, brief distress are pretty common human experiences at all ages. But when we see a problem persist, that's when we start to get concerned and want to offer additional support. And those changes in behavior may include a child always seeming sad, overreacting to minor stressors, and being easily upset or tearful. Having tantrums that are more frequent than usual, that are longer than usual, or that are not typical for their age. Having changes in sleep patterns, sleeping all day. You might see this in teenagers, reversing night and day. And in littler ones, sometimes we see difficulty initiating sleep, getting up after being put to bed, and even waking too early or waking in the night and coming to get parents. If we see children withdraw from their families or their friends, we get concerned. There may be changes in appetite, loss of appetite, or sometimes overeating or even binge eating. When we see new school problems, that's a sign of concern. Obviously, many children have struggled with transition to online learning and the lack of structure and direct instruction that they may be getting. But when you see problems that are above and beyond that, it is something to look at. With our older ones, using drugs and alcohol, especially if that is a change in behavior, if it's happening, if they're doing it alone, or if they're using in ways that are impairing their functioning. And finally, talking about suicide or expressing hopeless thoughts that get you worried. Unfortunately, this has become an increasing problem for our young people. And I've met children as young as 10 who have been treated medically in the hospital following a suicide attempt. So it is important that we prevent this by talking to children and understanding when that's at play, when there's a risk factor. One of the best ways we can do that is by simply asking the question. And we can do this with anyone we know of any age. It does not take a psychologist to ask, are you having thoughts of suicide? For people for whom that's maybe a passing thought or an expression of distress that they would never act on, we just need to get them outpatient therapy or counseling. And I'll give you some resources at the end of this talk for how to find that. But for people for whom we're concerned they will act on those thoughts, who are making plans to do so, we need emergency services. Any emergency room will evaluate and provide safety and care to anyone who needs these services. You can also call 911 if you cannot transport your child safely to the ER. And there's also the National Suicide Prevention Line. Kids can call, they can text the line, they can go on the website if they don't feel comfortable talking verbally. So that gives you a few resources to provide support when you have those concerns. Now, let's move to some happier thoughts and talk about reaching for wellness. We're looking at how the strategies that families and children can use to rally, to cope, and even to thrive in difficult circumstances. Dr. Crnic.
Yeah, let me jump in here just real. Ginger, just a quick thing, really. I don't know if you noticed on your screen, but that magnifier.
Can
we get rid of that?
We can definitely get rid of that.
Okay, good, because it blocks.
You can see that too, huh?
Yes, we can. Okay.
Sorry.
All right, thank you so much. Well, one of the things I just wanted to mention here before we jump into the important parts about coping and things like that is to understand that we know, right, that parents and kids have reciprocal relations, but we didn't always really treat it like that in research and in psychology in particular. And I think psychology has been historically one of the people that I would point the finger at, right, that has sort of promoted this idea that parents have immense control over their kids, right? That we had these ideas that parents are powerful beings and always can determine what happens with their kids. And really, we know that that's not true, right? There were these parent effect models that suggested that if kids were having difficulties, we would look at the parents for the explanation of why, right? But we know pretty much from research now that that's really not the single explanation for why kids struggle sometimes from time to time, right? There's not just a parent effect model, but there's also a child effect model where kids can have significant effects on their parents too. So that we know from a lot of research, in fact, that kids who are stressed, kids who have behavior problems, kids who are emotion problems, right, who are just struggling in one way or another, that has potentially tremendous effects on parents as well, not only in getting parents to be distressed for their kids, but in eventually creating enough distress that parents might show depression or some other problems related to that, right? So it goes both ways, right? Parents affect their kids, kids affect their parents, right? Seems almost too logical that to even say, but in fact, it took a lot of research for I think science to really come to this idea that there are support for reciprocal effects in these relations. And anytime we think about the nature of relationships between children and parents and how each can affect the other and help one another, right, that it's really important for us to understand that it does go in both directions. And one of the things that I think about stress in particular that's important is that in many ways, right, the kinds of things that create problems, right, for families and for kids, right, are things that are mediated by parenting stress. And parenting stress is a little bit different than just normal stress kinds of stuff, right? Parenting stress has to do with things that are specific to raising kids. Doesn't have to do with anything else other than being a parent and what the job is of a parent and how you parent, right? There are specific stresses and a lot of research that deals just with this idea of parenting stress. And parenting stress is much more predictive for what happens in families than is outside stress, right? Job stress or life stressors that people experience, right? Those things are important. They do have an effect on adults, but they don't have the same impact on family process that parenting stress has to have. And the connections between child distress or problems and parents' problems is often mediated by how much stress it causes parents, right? So we know that that's a really important thing. So as we start to think about how individuals cope and how we can help kids do that, we want to understand that both are important, right? Understanding how parents do what they do and kids do what they do, we have to work on both ends of that, right? To create good models for mental health.
If you've ever been on an airplane, you may recall the flight attendant telling you, in the event of a loss of cabin pressure, an oxygen mask will appear. And then they tell you to put on your own mask before assisting your child. I like to use this example to explain to parents the importance of taking care of their own physical and mental health so that they have the resources to draw from to nurture their children. I'm going to tell you a little bit about some simple strategies and behavior changes that can be helpful in creating resilience and helping parents navigate stressful situations. Cognitive behavioral therapy is an evidence-based type of therapy that we use to treat anxiety, depression, pain, and also to help people cope when they're adjusting to difficult life circumstances. There's two pieces to cognitive behavioral therapy, the cognitive part and the behavioral part. The behavioral part involves health behaviors, things that we can do in daily lives that we do have control over, that can in turn influence our mental wellness. One of the best strategies is to exercise regularly. This creates a lift in mood and alleviates stress hormones. Sleep. Adults need up to 8 hours of sleep a night. And without that, it is more difficult to manage emotion and stress levels. Social support is an important part of coping. And we can obtain that even when we can't be in person with a phone call, text message, or video call. Relaxation skills can manage affective states, emotional states. Something as simple as taking a relaxing shower. Distraction techniques and pleasant activities can lift our mood. Books, movies, things you have access to every day. And for those who have a creative streak, who enjoy writing, painting, art, this is a good time to spend some time on that. Another part of relaxation and focusing attention on more positive experience can be meditation, yoga, or simply listening to music. We know that companionship, even from a pet, makes a difference in our overall health. So spend some time with your pet if you have one. Exposure to sunlight, the natural light has an impact on mood and alertness. And so, 15 minutes a day of exposure to sunlight can make a difference. Play is not just for children. We all need that brightness and amusement. If you've forgotten how to do it and you know a child, I'm sure they will show you. And lastly, as we discussed before, know the signs, just like we talked about, the signs of difficulty with stress coping in children, they're similar in adults. If you need extra support, it's a worthwhile resource to get yourself some counseling so that you have the resources to take care of your child as well. Let's move on to the cognitive part of cognitive behavioral therapy. This has to do with choosing how we think to influence emotional states in coping. Choosing how you think takes a lot of practice. Sorry. I'm going to give you just a few examples because I know we don't have time for me to take everyone on a cognitive behavioral therapy journey today. But I'll give you some simple tips that you can try out at home that can be useful. The most basic of which is self-monitoring. It is simply noticing what you're thinking about and how that affects your emotions. To become aware, to observe your thoughts as if you were a wise outsider. And this alone can yield changes in how you think. Thought stopping When you realize you've been watching the news endlessly and are distressed. When you realize you've been thinking about the same distressing topic repetitively, it is important to shift gears, to be aware of that it's having a negative impact, and to shift to thinking about something else, to remind yourself to pull away from that distressing, repetitive thought. One fun strategy I like to use to show people that they can have control over their thoughts is scheduling worry time. If you find yourself worrying excessively about something that's bothersome and can't quite get yourself to let go of it, just reschedule it. Tell yourself a few hours from now, you can worry as much as you like about it for a good 10 minutes. Chances are that when you try to worry about it, it'll be less intense than when it comes on spontaneously. And this is a nice way to illustrate that we do have choices about where we put our thoughts. Cognitive restructuring is complex and has many parts. It has to do with how when we're struggling, when we're dealing with depression, for example, we tend to have very negative thoughts about ourselves, about other people, and about the world or the future. We can inoculate ourselves against stress in some ways by doing just the opposite, by finding things that we can remind ourselves of that are positive about ourselves, about others, and about the world. Lastly, you've probably heard in the movies, go to your happy place. This has to do with imagery, with focusing on thoughts of being in a place that you find very comforting. For some of us, this might be a beach vacation. For others, it could be somewhere else. It's amazing how our physiology even responds to this process. If I imagine myself in Hawaii and think about all the sensory aspects of that, my blood pressure will decrease, my breathing will slow, and I will react as if I really were on that vacation. And that has a remarkable impact on both thoughts and physiology. Dr. Crnic?
Yeah, let me just jump in. I'm not going to spend a lot of time on this, but I just want to say, from a research point of view, nothing probably has been as well researched and has garnered as much evidence for its support than has cognitive behavioral therapy. Recent reviews have shown this. The focus is not just on better outcomes for people from a mental health perspective, but also better ways that we can offer these services. Below, I list a number of things that relate to the topics that Dr. Carlson has just sort of laid out in more sort of typical research language, right? But every single one of those has gained evidence to support its use to have a positive effect on people's emotion and behavior. So I just want to sort of reinforce the idea that cognitive behavioral approaches are very effective. They work with kids as well as adults. And even though we know a lot, there's still a lot we need to keep doing with that, but this is very good work.
Now that we all have our oxygen masks on with some of those cognitive behavioral strategies, let's shift our attention to taking care of kids. You noticed perhaps at the beginning of this talk, I started with acknowledging the stress of this year. People of all ages, including children, want to have their experience acknowledged before you move on to giving strategies. And so it's important to start with noticing and listening to our children. Observe behavior and the ways that their play, their drawing, and their emotional states tell you how they're doing. Ask open-ended questions to get them talking. Listen quietly without distractions. Put your phone down, make eye contact, or just sit by them quietly and hear what they have to say. acknowledge what's expressed, and rather than correcting it. This can be hard to do. I recently had a parent whose child said they felt sad say, "But you looked perfectly happy at the park yesterday." It's important to acknowledge what they're experiencing in the moment, because sometimes children are very focused on the present. And at last, spend time together. Find things that you can do that allow you to enjoy your child and for them to enjoy you, because that builds the warmth in relationships and makes them more likely to disclose what they're experiencing. And many of the cognitive and behavioral strategies we discussed that help with adults are also useful for children. You can create a healthy home life for them that is reliable and predictable, even when the rest of the world seems a little unreliable at times. Routines are a good way to do that. Having a clear breakfast time, a clear dinner time, a bedtime, a time for everything gives children a sense of security, gives them the idea that we know what we're doing. Children need a great deal more sleep than adults. School-age children need about 10 hours, and teenagers actually need around 9 or more hours, but rarely get it. Exercise is always important. Children benefit from about 60 minutes of activity a day. Nutrition matters. So if your child is able to make their way across all the food groups, that's going to be important. Again, sunlight, time outdoors, exposure to that natural light. Children benefit from social support and need contact with same age peers. One way to get that during the pandemic year has been online. While it is important to monitor your children to know what they're doing online and that they're communicating with someone known and trusted, they can derive a lot of comfort and enjoyment from chatting with their friends and playing together online. Pleasant activities lift mood, and so as much as we can get access to those and create them at home, so much the better. Children need unstructured playtime when you don't have activities scheduled and they can just relax and do imaginative play. Younger children especially use this to regulate emotions and practice the skills of calming. Children don't have a lot of choices in their position in the family. So when there is a choice, even if it's between grape and orange, give that choice so that they have a sense of empowerment. And as we adults model those positive adaptive coping skills we discussed earlier, children will notice what we're doing and mimic that. And as we said before, enjoy your children in whatever ways you can, because that is an important ingredient of the parent-child relationship and of their coping. Resilience. I think one piece of really good news is that even if we can't quite do all of these things, even if we struggle, children are, for the most part, biologically hardwired to find their way to be okay. So even when they do deal with hardship, even when we can't get everything together, when they're fairly normally developing and their caregivers are fairly well-intentioned and loving, they do well. And it may very well be the fact that the vast majority of our children recover completely from this pandemic year, emotionally, academically, and go on to delight us. There are certainly children who are vulnerable, especially to having more difficulty with that resilience. Children with developmental delays, complex medical needs, children with serious psychiatric disorders, and children whose families are struggling with chronic acute stressors that are compounding the problems of the pandemic, things like poverty or community violence, need our extra attention and support. Dr. Crnic.
Yeah, I just wanted to say about the concept of resilience is that there's an idea about it that's kind of one that really appeals to me, and it's what Anne Maston calls that resilience is about ordinary magic. It doesn't really take anything incredible or unique or novel or magical for us to create resilience in kids. It's really just as you were saying, Dr. Carlson, right? That lots of kids are hardwired to do this, right? To be adaptive and to make things work, even under the conditions of extraordinary adversity. Kids can come through that okay, and they can come through that okay without us doing really anything special to help them, right? That they do that. And it's this powerful force within kids that makes things work out okay. It doesn't work for every kid, right? It would be great if it did, right? Some kids, like you were saying, really struggle with that. But the ordinary magic part of that is that it's nothing really special. It's a lot of normal, typical, everyday experiences that support kids and their adaptation and help them to become really functional, competent adults, right? So it's a great thing that happens the way that it does. And it doesn't mean that some kids don't need help. Many do, right? But the fact that a lot of what we do ordinarily and every day helps support kids is a really great thing. So with that, I think we're going to say that there's, you want to talk about these for just a second?
Sure. I just found my typo. That should say search engines. This is a list of resources that you can use to find a therapist for your child or yourself. Just a few options if you feel like that additional support would be helpful.
Okay.
Okay.
Great. Well, we're going to open this now to a question and answer period, and I can see that already we have a number of questions, all right? And so I will read them, right, as we go through these, and Dr. Carlson, you can start us off with answers, right? Hopefully,
Okay.
right? So one of the questions that we get is that, do younger children, say toddler or preschool age, need different coping strategies than school-age children or adolescents? And can you talk about those strategies?
Certainly. As we talked about briefly, the little ones, they're going to be that much more affected by their household and family world, in that their world is a little smaller in some ways than, say, an adolescent who might get a lot of support from school and peers. So in that way, the impact of parent well-being on child well-being is especially important. They're looking to us to model how to cope and how to think about things and respond. Also, unstructured playtime is remarkable for little ones. This is a way that they self-regulate, that they cope, that they play out in some ways some of the things they're experiencing and can share that with us. There's something that called parent and child special playtime, where you can spend time in unstructured play with your child and let them guide you without giving a lot of direction, and just kind of noticing what they're doing and being a little bit submissive. And that is a very nurturing activity and really provides a lot of comfort to little ones. So those are a couple of examples.
Great, thank you. We have another question from Heather that it asks, do you have any advice for teenagers specifically who are hesitant to talk about these issues?
Yes. It may be sometimes that we're right in the middle of a stressor and we're not ready to process it verbally because we're still experiencing it. So you'll see a lot of kids, people of all ages, really kind of hunker down and try to tolerate this stress without really acknowledging and discussing. Nonetheless, those health behaviors are still important: creating routines, getting exercise, staying engaged in family activities. So it's okay to respect your teenagers' boundaries, as long as you see them doing fairly healthy things that will move them in the right direction. But if you have concerns, it may be important to get them in touch with a mental health provider.
Okay. So we have another question then from Shavana, who asks, for those of us who are seeing patients and their parents in person, are there any recommendations for whether or not to screen for temperature symptoms in both patients and parents prior to coming into the office?
Well, I'm not a medical doctor. I am a psychologist, but that being said, as I work at a pediatric hospital, I have some experience with this. And we have a COVID questionnaire people are required to complete prior to coming to the office the day before regarding any symptoms. If they have symptoms, we ask them to stay home. And when they come in, their temperature is taken and they're ensured to have a mask. So those are a few things you can do to help protect those who will be coming into your office setting.
Okay. Here's another. Can getting sick with COVID cause kids and parents additional psychological problems even after recovery due to the impact of the virus on the brain?
I think that it is pretty early in us encountering this virus to know yet what the long-term effects might be. Certainly psychologically, in terms of the stress, a lot of that is influenced by the way we talk to ourselves and to our children about what's happening. So if we get the virus, we need to talk about resilience, about immune systems, about health and resources that we have, that it is true that the majority of us recover, and that if we're struggling with symptoms, that we can get the help we need. In terms of the long-term impact, this probably has things to do with whether or not there's been an impact on vascular systems and in the brain, which my understanding so far is that that is a small subset of people. But I think it's maybe too early to know for sure.
Okay. There's a question from Resha about how do we support children with various developmental delays during this time?
That can be hard. I've heard from a lot of families whose children have had to do online school, and it's been more difficult to implement some of the things that they need. They're not getting the access to the community supports that really benefit them. So certainly once you feel that it is safe for your child to get back into in-person schools, and to get access to their therapies, that's important. Prior to that, in a way, we're just doing the best we can. So you're doing what you can. If you have anyone who can help, to provide childcare at home, that can be important, and to keep them engaged and active in pleasant and learning activities. They may not follow the school curriculum. They may not make the level of progress they would have in a year when they had access to all of the community resources, but forward movement and positive mood are ingredients of resilience.
Good. Okay, here's an interesting question from Brittany about my 1-year-old knows only this way of life of having both parents and his 2 siblings at home every day, all day. What is the best way to transition to full-time care away from home once that time comes?
Well, one remarkable thing about the little ones is that they adapt to what's going on around them pretty readily. That's what one of the things that really enables them to cope with changing circumstances. And so it isn't unusual, really, for a child this age to be at home in full-time care at home and then to be in childcare at a certain point. So we just talk about it in positive ways, about the adventure and the new people we get to meet. Allow your child to see you having positive interactions with the care providers where you'll be using those services, and be very consistent about routines so that they know when to expect you to pick them up, so that They see you expressing confidence and calm at drop-off. And they tend to rally pretty quickly, although children will sometimes have some separation difficulties when they're dropped off. They settle for the most part really nicely once the parent leaves. So don't allow that first moment of distress to impact your whole day. Your child will probably be having a good time after a little bit.
Great, thank you. Now, here's a question I'm sure that you face often, and that as psychologists, we get a lot. Like, what do you do to make talking to a psychologist seem okay? My 7-year-old is very reluctant and scared to share her feelings with a professional.
Sure. It's really important that you pick someone who has experience in pediatrics, who understands child development and does not expect your child to sit and talk like they're an adult. Pediatric providers understand that children may be slow to warm up. They may not be able to verbally express everything, and that we absolutely need to engage in activities like play and artwork and other things to help develop rapport and help them feel comfortable. And then we gradually integrate talking about difficult topics into the play and respect the child's boundaries and back off when they need a break. So find a provider you feel comfortable with, who you feel is nurturing and is not too adult identified. We can talk to children. I sometimes tell children that having a psychologist is kind of like having a teacher for feelings. We play some, we do art some, and we come up with some good ideas and strategies to feel good more often.
Great, thank you. All right, so then another question is, do you have any suggestions for families and children who are experiencing grief due to COVID-19? And how can you support them?
Yes, this is especially difficult, in part because of the lack of access to some of the community resources and extended family contact that supports people in typically dealing with grief. This may mean that the process of grieving is extended even further across time until we get those needs met. It is really important with grief to acknowledge that it's a shared experience. Sometimes children feel very isolated and their parents try to keep them from seeing that the parent is also grieving. That makes children feel that the experience is unique to them and they don't know what to do with that. When families do it together, even if it's distressing, when they can hug, sometimes cry, look at pictures, and then take a break from that acute distress to do good things for themselves, that can be helpful.
Okay, good. I think we're going to do 2 more questions, and I know that's not going to be all of the questions that we have waiting, and I'd love to be able to get to them all, but I think we're going to just run out of time here. But the next question is, my teenage daughter just had her first appointment with a psychiatrist due to feelings of depression. My question is, how involved should I be with the psychiatrist? I guess I'm a bit stressed about my place in this new situation as a parent. She'll be having regular appointments for CBT, and I'm not sure what's the best level of involvement or contact for myself.
This is a process that needs to be negotiated and discussed with the therapist. While I typically hear that psychiatrists are providing medication management, it sounds like in this case, the provider is also providing therapy. So if I'm correct about that assumption, discuss with the provider how much to be involved. So the therapist needs to provide a teenager some level of confidentiality so that they'll be open. And your child may have some feelings about how much to involve you. Nonetheless, it's important for parents to know how their child is doing overall in therapy, and also to be able to share with the provider any concerns about how their child's doing at home. You may arrange to have part of the appointment with you and your child together and part with your child alone. Or you may arrange to do that every few appointments. But it's important to bring up and to discuss, to come up with a plan you feel comfortable with.
Okay, one last question. Okay. In terms of temperament, some children are more impulsive and active, and others are more reflective and thoughtful. in general, for children ages 7 to 12, what are better approaches to help them cope with stress and anxiety about death and illness from COVID based on their temperament?
Okay. So children who tend to be very active benefit from the opportunity to have a lot of physical activity. They may actually self-regulate through exercise and play. This is true to some extent for all children, but you'll see when your child needs more activity and is feeling a little stir crazy in the home. And for children who are more subdued and withdrawn, they may be less likely to verbalize what's going on. You may be less likely to see areas of difficulty. So it's important to draw them out and to make space and time to talk with them. In terms of coping with the stress and worry of the pandemic, children don't have the ability to appraise risk in the ways that adults do. When I hear something is 0.02% likely to happen, I feel relief. Children don't have a sense of that being unlikely. So they may be very concrete and think in kind of more black and white ways. In that way, you know, just the other day, my younger son said to me, isn't like 75% of the world's population going to die of COVID? And I said, my goodness, no, not nearly that many. But it surprised me that he thought that. And so they may not feel safe in the ways that we can reassure ourselves to feel safe. And they need a lot of concrete comfort. You use your hand sanitizer, you're wearing your mask, you're outside, we're good. That kind of thing. Even though we can't make promises, to kind of give them reassurance, you're doing safe things. We're doing a good job of navigating in the world and keeping you healthy.
Yeah. So let me jump in here because I think we're down to our last minute or so. Okay. So I want to thank Dr. Ginger Carlson for joining us today. I want to thank everybody who participated with attending of our webinar. And I'm encouraging you all to go to our website at imhr.org and look for our upcoming webinar series and make sure that you complete those polls. Someone also asked if we could post some information about numbers. Here are some numbers, and I'm sure we will have those up on our webpage available for everybody to look at. So again, thanks to everybody, and hope you all have a great day, and hope to see you next time on our next webinar. Thank you very much. Ginger, thank you.
Thank you.
You were really great. It was really fun to listen to.
I enjoyed talking with you.
All right. So I assume we'll be in touch, and you know, any other kinds of info you want back from this, I'm sure we'll share.
Sounds great. Thank you.
Take
care.
Right. And
Bye.
tell your family thanks for loaning you to us too.
It was